Hi, this is Dr. Jonathan Spages, and I make these quick videos for people who either are diabetic or could be suffering from diabetes or have a loved one that have diabetes. I've had such great success with helping people reverse their diabetes, but I take a whole different approach. So on this particular video, what I want to talk about is actually something very, very interesting, and it's almost unbelievable, for lack of a better way of saying it, but I want to give you some little different tidbits on how to actually reverse diabetes. And once again, this is not traditional. Okay, so first off, I want to go over a couple of key things. First off, diabetes, especially type 2 diabetes, is number one, not the cause of the problem. It is a symptom of the problem. The metabolism is broken, and unfortunately, your body's not regulating it, or your loved one's body who is a diabetic is not regulating it, and thus forth, you cannot keep your blood sugar at a stable rate. So it's very interesting because the approach I take, first off, is finding the reason why someone's a diabetic. And the way I do that is not by, some magic wand. It's actually by doing very, very, very comprehensive labs to figure out why someone's actually a diabetic, right? So not just the basic labs of blood, okay, because that just gives you one kind of part of the body, but you have to really do a very comprehensive workup, which includes things like blood, there's saliva testing, there's stool testing, just very, very, very comprehensive tests. So anyway, upon getting these comprehensive analysis, it allows me to really know what's causing the person's diabetes in the first place. Now, I have an interesting story about a set of patients that came to see me. And these particular patients, they were twins, okay? And they were identical twins. You could not tell them apart. And they were both diabetic for a different reason, believe it or not, okay? And the only way I figured it out was when I ran the lab workup on them, okay? Now, they're both diabetic, taking basically the same medications, same blood sugar medications, cholesterol, blood pressure medications. However, the reason why they were diabetic was completely opposite, meaning like this, even though they're twins, they looked identical, you couldn't even tell them apart. One of their diabetes was not caused by organ imbalance as much as it was by infection. And the other one was more organ imbalances as opposed to infection. And the irony of it is that the way I approach diabetes is a very customized approach, meaning that, like for instance, even though they were both patients, I would typically see them at the same time. They would both come in for their visit with me one-on-one at the same time. Their treatment protocols were very different. Even their diets to some extent were different, okay? Because I couldn't treat them both the same. Even though they looked the same, I couldn't treat them the same because they both had a different reason why they were both diabetic. So essentially, what I had to do with them is customize a specific approach with diet and supplements and things of that nature. And it was awesome. And I'll tell you what was so kind of ironic about it. So they both got the re-blood test. So, an initial workup I do is very comprehensive, looking at pages of labs. But about 6 weeks later, typically for most people, I rerun tests, right, to see what's improving. Maybe their doctor reruns the test to check their A1C, basic blood sugar numbers. But the irony of it is they both had the initial testing done at the same time, right, when they both, enrolled in my plan. And then from there, about 6 weeks later, they did a retesting on it. And they literally both pretty much reversed on that exact same day, 6 months later. Their A1Cs dropped tremendously. The doctor was taking them off medication. And that was really amazing, especially since they both had different reasons and they both got tremendous results in a very short period of time. Okay, so this answers the question about diabetes. And the problem that most people run into when it comes to diet as being a diabetic in the United States is that when they go their traditional approach, right, they go to the doctor gives them basically the same medication to everybody. They don't really see an improvement over time, right? They see that they get worse. They get one pill and then another pill and another pill. But you really have to get down to the root reason of why someone's a diabetic. You have to really dig to really figure out exactly what's causing their diabetes in the first place. And the amazing thing about it is that you really want to make sure your plan is custom to you. Should you be eating? Should you be exercising? Should you not be exercising? What supplements are going to be needed to get your body functioning well, okay? So it's really, really important to understand it has to be individual. Like you cannot do a one-size-fits-all approach if you're a diabetic. Meaning you have to be treated as an individual, not as a herd or a disease. Okay, so if people go to their doctor and they're getting the same medications as everybody else, they're getting the same guidelines of watch what you eat, and the basic fundamentals of being a diabetic, they're going to get the same results as everybody else. And we already know in this country, it is literally, I mean, person after person is becoming a diabetic almost, more and more every day. So obviously that approach isn't working. So if you like a different approach, you want to know more about it, there's a link below to a webinar that I put together that really explains my approach, how I'm able to get results, why my results are so good, and what it would take to become a patient in my office. Okay, so check that webinar out for you or your loved one, and if you have any questions, reach out to us. But this should hopefully give you a different insight of the condition and some other options you have, as opposed to just being trapped in this disease. I mean, how many more pills does this person need before they realize it doesn't work? Okay, so thank you very much for watching. I hope this gave you some insight and some benefit, and once again, have a great day, and thanks for watching.